This course, or basically it's an examination that's organized by the Dutch Society of Surgery. So at the end of your general surgical training, you can be certified for vascular surgery.
This course here is an obligation for every vascular surgery resident in the Netherlands. Here at the Twente University, which has a large training and simulation center.
We use the simulators both undergrad education all the way up to postgraduate education and assessment, like the CASH-3 Vascular course. We've been doing that for about 9 years now. This way of assessing potential vascular surgeons ended up increasing the quality of the education quite dramatically.
Students come in and we have a 30-minute oral exam in which we test their knowledge on diagnostics and treatment. Half an hour in which they can demonstrate their skills and knowledge in the treatment on Simbionix trainer.
A simulation of the EVAR procedure, simulation of the PTE of the common femoral artery, simulation of the PTE of the superior mesenteric artery. So that they can really demonstrate their skills in a stressful situation.
The simulator really facilitates the conversation between the examiner and the trainee, and it gives a very important context to the conversation.
We split the whole procedure in very small steps, and we asked the resident to start the procedure.
You can see how the students are performing, how their skills are, how their approach is, so they can demonstrate how they step by step build up the case and build up the treatment. Safety is an important issue which we're trying to assess.
When I was a resident, I was also assessed on the simulators.
It's the second year I'm doing this, and a couple of years ago I was a young vascular surgeon myself, being tested here.
During an assessment with Simbionix, you can select your materials and basically go through the procedure step by step, just like in a real patient.
You can immediately see if someone has experience or not.
And there's no other way to safely practice all these endovascular skills.
It's really close to real life.
It's a very good opportunity to present your skills.
The fact that you actually have force feedback when you're coming close to and past a lesion.
Show what you actually can, not only by explaining the steps, but also to do it in real life. And that it's very much real when you see the angiography results and the placement of the balloons and the stents.
It's relatively intuitive to use, don't need any instruction to utilize it.
Nowadays, during the European examination of the European board, nearly always the top 10 are residents from the Netherlands.